What is the usual duration of a polygraph testing? Polygraph examination normally takes from 1 to 3 hours depending on the purpose of the examination as well as the subject's attitude and any other factors that causes lengthy examination. What are the procedures, phases followed in the polygraph technique? There are several phases to follow in polygraph examination and they are as follows. Phase 1. Preliminary preparations. This stage is the initial interview with the investigator handling a case or person requesting it. The group involved in this stage are the victim or the complainant, suspects, and witnesses. This stage includes obtaining an evaluation of facts, determining areas the subject needs to be asked, and the investigator must furnish the examiner of the following: sworn statement of the suspect, witnesses, victim, complainant. Incident or spot report, BI of the suspect, witnesses, and the victims or complainants. Rough sketch or picture of the crime scene and other facts such as specific article and exact amount of money stolen. Peculiar aspect of the offense or any strange set. Exact time the offense was committed. Known facts about the suspect's action or movement. Facts indicating any connection between the suspects, victim, and witnesses. Exact type of weapon, tool, or firearms used. Result of the laboratory test. Unpublished facts of the offense known only by the victim, suspects, and the investigator. Preliminary observations. Behavioral observations of the subject begin from the time he enters the reception room until he is escorted into the examination room and must be recorded by a secretary or receptionist. Note should be made of any illogical or unreasonable objections to taking the test, such as strange physical ailments that are sometimes devised by the subject in an attempt to avoid taking the test. Phase 2. The pre-test interview. This is the stage of interview of the subject. The primary purpose of the pre-test interview is to prepare or condition the subject for the test. The following should take considerations. The appraisal of subject's constitutional right. Obtain subject's consent to undergo polygraph test by signing a statement of consent. The taking of personal data of the subject. Determining his/her suitability as subject. Evaluating the psychological preparations of the subject. Informing the subject of his involvement with the case. The following are rights of the subject must be informed clearly to him or her. The right to remain silent. Anything he or she say may be used in favor or against him or her. The right to have a lawyer of his/her own choice. Right to refuse. As earlier noted, subjects will not be scheduled for examination when they are obviously fatigued or in ill health, physically injured, or in pain. Their judgment is obviously influenced by or impaired by drugs, alcohol, or have just suffered emotional trauma. The examiner's interview with the subject prior to the test is of considerable importance, both for the purpose of conditioning the subject for the examination and also in order to provoke and observe the helpful indications of guilt and innocence which are often forthcoming at this time. The following is detailed outline of the pre-test interview which has been found to be effective. We assume that the subject has already been advised to the fact that he is to be given a lie detector test. As the examiner enters the waiting room to request the subject to accompany him into the examination room, the greeting which the examiner extends should be cordial but firm. Upon entering examination room, the subject should be requested to sit down in a chair alongside the instrument, and immediately thereafter, the examiner should process the taking of consent of the subject. Then fill up the necessary data asked in the interrogation log. Afterwards, inquire from the subject whether he has been on a lie detector test before. No further comment should be made by the examiner, but he should listen carefully to whatever the subject himself may say. If the subject has not told of the purpose of his appearance in the testing laboratories, the examiner should explain that a lie detector test is desired of him as part of the investigation regarding the case. Much time should spend in the preliminary interview as circumstances reasonably warrants. Phase 3. The examination proper. After the pretest interview, the examiner should proceed to the placement of attachment of polygraph sensors. The first to be attached, the pneumograph, followed by the cardiospimograph and the galvanograph sensors. Review all the questions with the subject before the actual examination is made. The examiner should discourage any comments or statements by the subject. Test instruments must give the subject upon completion of the necessary preliminary preparation. The instrument is attached to the subject then. The blood pressure cup is wrapped around the subject's upper arm or bicep and the pneumograph tube adjusted around the chest and abdomen. The cup is then inflated to a point approximate midway between the systolic and diastolic blood pressure, that is midway between the pressure produced by the output action of the heart and maintained at the time of the heart intake action. The synchronous motor carrying the paper upon which blood pressure, pulse respirations recording are made is then set in motion. The motor being so timid that the paper moves along at the 6 to 12 inches per minute, then 10 to 15 seconds after the instrument has been set in motion, the ink-filled pens of the instrument are permitted to make their blood pressure, pulse, respiration tracings before the question are asked of the subject. Excuse me. During the test, the subject is informed that he will be asked several questions which should be answered by either yes or no only, and that they are so brief and straight to the point. Approximately 5 to 10 seconds after this instruction, first question is asked and then the other questions follow after or at the interval of 15 to 20 seconds. Limiting scope of questions. The relevant test questions used in any examination should be confined to a single case investigation. The polygraph technique is not effective for stimulation testing regarding two or more unrelated occurrences. Irrelevant questions. These are questions which have no bearing to the case under investigation. Relevant questions. These are questions pertaining to the issue under investigation. It is equally important to limit the number of relevant questions to avoid discomfort to the subject. Control questions. These are questions unrelated to the matter under investigation but are of similar nature, although less serious as compared to those relevant questions under investigation. The stimulation test. The examiner then inspects the chart and asks the subject about his or her reaction to the questions. The usual purpose of obtaining subject's reaction is to allow refinements in the questions. The questions are reviewed again and when necessary, further clarified. The examiner may then administer a stimulation test designed to improve test validity. The examiner will then continue to test and obtain 2 or 3 more charts in same way. Obtain blood pressure tracing. Obtaining proper tracing of pneumograph. Obtaining proper tracing in galvanograph. Application of the electrodes to the subject. Position the hands or tip of the fingers for convenience. Adjust the sensitivity. Sensitivity test. Have subject take a deep breath or touch subject ear or neck or make a quick motion within subject's line of vision. Technical production of tracings. For cardio tracings, the ascending line pulse wave causes an expansion of the arterial wall and an increased surface pressure against the cup bladder, thus forcing air from the bladder through the tubing into the timbre. Descending line. When a pulse wave passes beyond cup bladder, attendant drop in a surface pressure against bladder reverses this process, permitting the below or return to or toward its original position. Diacrotic notch is caused by the minor secondary pulse wave passing under the beyond the blood pressure cup. The pneumotracings, ascending line with expansion of the chest during inhalation. The air capacity in the pneumograph tube is increased, creating a vacuum within the system, which reduces the internal surface pressure against the below. Descending line, caused by the exhalation, thus reversing this process, causing an increase in the internal surface pressure against the bellows. For galbo tracings, the ascending line bit is caused by the decrease of the subject's resistance, which throws the established circuit out of the balance and modifies the electric current flow through the magnetic field surrounding the pivot movement of the recording pen. Descending line physical cause is caused by the reverse in the subject resistance toward the original position, this bringing the circuit back or towards balance against producing a lateral clockwise or downward movement of the pen. What is the standard computing rate? The graph paper is lined in space in second. It is moving under pens at a uniform rate of 6 inches per minute. Rate is kept uniform through medium of synchronized motor. From one heavy vertical line constitute 5-second period. It is also 1/2 inch count. 1/2 inch count the beats inside any 5-second scale multiplied by 12. This gave your number of heartbeats at any point in the test. For greater accuracy, you count the beats in 2 5 seconds or multiplied by 6. Phase 4. The post-test interview. This stage includes all consideration that bears on the examination. This is done just after the instrument is turned off. If the polygraph test result indicates deception, the examiner will then proceed to conduct short interrogation, the purpose of which is to obtain confession. However, if the polygraph indicates that the subject is innocent, the examiner will just release the subject cordially and thanks him or her for his or her cooperation. The purpose of further questioning after the test are to clarify the findings, to learn if there are any other reasons for the subjects responding to relevant question other than the knowledge of the crime, and to obtain additional information and admission for law enforcement purpose if the result suggests deception. What are the types of test questions and how they are constructed? The polygraph test consists of asking the subject person through a list of prepared questions in a planned sequence comprising of not more than 12. At least 3 test charts are taken, each lasting not more than 4 minutes with a rest interval of 5 to 10 minutes between charts. These are 2 general types of questions to be constructed and may be supplemented by other types of questions. Peak of tension test or the PTT, which is usually used as supplementary test. GQT or the general questions test is the most commonly applied. How does the general question test formulated? The GQT consists of series of relevant and irrelevant questions asked in a planned order. Questions are so arranged as to make comparison of the response to relevant questions with a subject norm made during the answering of relevant questions. The relevant questions are the questions directly related to the offense under investigation. In pre-employment, the periodic screening, the area of interest may be series of relevant questions such as, have you ever been fired from a job? Or have you stolen more than 50 pesos in 1 year from any of your employers? Relevant questions are further classified according to each stimulation effect when applied, namely, strong relevant or primary relevant question, secondary or weak relevant. Further, the weak relevant classified into the following: sacrifice relevant or diet questions, knowledge questions. At this type of instance, the praise for sure is included to eliminate further suspicion just in case the subject knew that the offender and the location of the evidence but is only hesitant to answer yes. Evidence connecting question. This has to do with inviting subject's attention on the probability of incriminating proof that would tend to establish his guilt by linking him and his predicaments to the fingerprints, footprints, tool marks, and etc. collected at the crime scene. The control questions. Control questions are used for purpose of comparison. Essentially, truthful subjects are believed by polygraph examiners to be more concerned and thus more physiologically aroused about controlled and relevant question. The response to both control and relevance questions are compared. Controlled questions have two kinds. Primary control questions recalls the offense done from the time of the childhood up to 3 to 5 years before the occurrence of the present offense is being investigated. Secondary control questions, more specific in nature. It is based upon other sort of wrongdoings which is enhance the subject opportunity to the responsiveness. The irrelevant or neutral questions. Type of questions which have no important case under investigation. These are questions which are believed to have no or very little emotional impact on a subject. Thus, such questions can be used as an indicator of a particular subject's normal baseline level of arousal. These must precede the relevant ones. Sample set of general questions test or the GQT. General questions test case. TEP. Laptop computer owned by Mr. Abraham Castro of Sunrise Computer Shop. Are you familiar with Sunrise Computer Shop? Do you know who stole the missing laptop computers? Do you steal the missing laptop computers in Sunrise Computer Shop owned by Mr. Abraham Castro? Did you assist anyone on stealing of the missing laptop computers in the Sunrise Computer Shop owned by Mr. Abraham Castro? Do you have any relationship with the complainant? Is there any reason anyone would fabricate or lie about the incident? Do you have a heavy financial obligations that was need of settling? Are there any evidence to support or prove your claim? Are there any witness to validate your whereabouts during the time of the incident? And lastly, how do you respond to the allegations? And that's all. Thank you.